Australian researchers have found that families with a history of genetic heart disease can suffer from an even greater level of anguish than losing a loved one that's comparable with post-traumatic stress.
It's prompted calls for vastly improved counselling services. Joanna Woodburn reports.
Edward Hastings was 1 month into his gap year in England when his mother received devastating news.
We got a phone call at 4:30 in the morning saying that he dropped dead on a rugby field.
The fit and healthy 17-year-old died from an undiagnosed heart condition. 4 years later, his older sister Lucy discovered she had the same risky genes.
There was definitely an element of loneliness in that. I think just knowing that the one other person that would relate or be experiencing the same thing as me was gone.
For anyone losing a loved one to a heart attack, the experience is traumatic. For the Hastings family, the loss was even more harrowing, facing genetic testing and learning about their own cardiac risks. Situations like this prompted researchers at Sydney University and the Centenary Institute to examine the psychological impacts of cardiac death in young people.
1 in 2 of the family members reported post-traumatic stress and prolonged grief in a range that really needs intervention with a clinical psychologist.
Dr Ingles says the findings show every family should be offered special counselling as early as possible. The researchers acknowledge that the medical and clinical needs of families are taken care of, but say psychological assessments are rarely carried out. They're suggesting specialised input from clinical psychologists to help people cope with the grief and the possible risk to their own health. For Lucy Hastings, bereavement counselling was vital.
Despite the traumatic nature of reliving that stuff with the counsellor, it was also very helpful.
The researchers hope this type of support becomes standard practice around the world. Joanna Woodburn, ABC News, Sydney.